people on the ground have lost hope. People are disappointed. Healthcare workers, communal care workers have lost hope because they are working under unbearable conditions. In June, when we were in Northwest, most of the clinics were closed because the communal care workers were on strike. And when they are on strike, clinics are closed. So issues of healthcare services with regards to migrants, where when they go to healthcare facilities, they are being discriminated, whether they are documented or not documented. So there are a number of challenges that we are facing in the Northwest province.
Is the Northwest public health system in crisis? When will the reports of medicine stockouts end in that province? And are there any plans in place to improve the services in the Northwest health facilities? Hello and welcome. I'm your host, Dr. Musamtomene. Signing with us is Trifosa Ntsolengwe. Today on Vital Signs, we focus on the Northwest Provincial State of Health. Coming up on the program, we'll listen to an insert produced by Zama Buthelezi as she spoke to General Secretary of the Treatment Action Campaign about the state of the public healthcare system in the Northwest. We speak to the Northwest Provincial Health spokesperson about the challenges in the province as well as in the public sector there. And we'll speak to the clinical lead of COVID response and vaccination to give us an update on the COVID-19 vaccination program. Zama Buthelezi will update us on the latest South African COVID-19 numbers, and Dr. Marlon McKay will answer your questions about COVID-19 symptoms. Remember that you can be part of the show by asking some of the guests that we'll have on the show some questions and, of course, sharing what's on your mind. We want to know what you're thinking and discussing with us. And, of course, the number to call is 0117-145861 or 0117145877. That's how you get a hold of us. But, of course, you can share your thoughts with us on social media using Twitter at SABC Vital Signs or on Facebook. That's the page that is SABC Vital Signs. So you know what you need to do. Vital Signs continues after the break. Stay with us. Welcome back. This is Vital Signs. I'm Dr. Musamtomene. The Northwest Public Healthcare System has been in a state of crisis for many years. Reports of persistent and widespread stockouts crisis, of course, across the province have seen many patients being sent home with nothing in their hands, with a shorter supply of maybe some of the essential medicines that they'd be getting. And of course, this is a problem. So TAC's Anele Yawa spoke to Zama Buthelezi about the Retide project, detailing basically the state of the public healthcare system within the Northwest. Let's listen to the interview.
Anele, thank you so much for the interview. Anele, we've been reading reports about the state of public health in the Northwest. It's not something new. Briefly, talk to us about what is happening there. Is there a crisis? Is it in the state of collapse? What is happening?
The state of healthcare services in Northwest is about to be on its knees. And there are a number of contributing factors to that. You will remember that Northwest Province is still under the administration of the National Administrator, who was appointed to intervene in terms of addressing some of the challenges. And the question we must ask ourselves, since the National Administrator has started until now, what has been achieved and what has not been achieved? Like for instance, if Anele was supposed to be given a month supply of medication, Anele will be given a 2 weeks supply and Anele will be forced to come back. Also, because of issues around the human resource for plan, we know that not only in Northwest, but also in other provinces, posts were frozen, came COVID, many healthcare workers have succumbed to COVID, and now the issue of vacancies is becoming a problem. And as the result of that, healthcare workers are overburdened because you find out that one nurse is doing maybe the job of 2 or 3 other nurses. And as the result of that, they end up venting their frustration and anger to patients, which is not acceptable. That's why we're talking about issues of staff attitude. And in some instances, there is non-confidentiality and involuntary disclosure of illnesses of patients. These are some of the challenges that we're picking up on the ground, but also we cannot run away from infrastructural issues. If you go to Northwest, some of the clinics that are in these semi-rural areas, you might pass them if there is no one from Northwest, because they don't look like clinics, they look like houses.
What are the people saying on the ground?
They have lost hope in this. Like, I will give you a typical example. In Northwest, there is an area which is called Itoseng. The community of Itoseng, they don't have access to water. They have to wait until 2 p.m. in order for them to get water. I don't know for how long. And the question you must ask now, if people are unable to access a basic thing like access to clean and running water, how are those people going to adhere to their treatment? How are those people going to adhere to health measures in terms of preventing the COVID-19? So that on its own shows that in Northwest, there is a lack of a political will and a political commitment.
Anele, as TAC and other organizations, I remember the issue of stockouts came out a few years ago, and Nehao was also on top of it, asking what is happening, why are there no medicines at clinics, at hospitals, and at public health facilities in general. From your understanding, when you talk to them, what is the problem? Why are there no medicines at these facilities?
There are senior officials within the provincial medical depot who were suspended, who are still suspended from 2 years back until now. So you find out that either some of the people who are working at the provincial depot, either they are incompetent or it's a deliberate sabotage. Because as I have said, the factional battles within the governing party are contributing to poor service delivery, because if one is on this faction and is expecting the other faction, or the one who is on other faction to approve certain things, the one on the other faction will not approve things that are requested by the other.
Anele, the report was released end of June, I believe. What has been the response from government? Are you seeing something happening? Is there any movement happening?
From June until yesterday, there was nothing happening. And as from yesterday, we had a meeting with the office of the HOD in the province with other directors, where they responded to some of the issues that we have raised. As I have said, we said to them, us having a meeting with the Department of Health in Northwest does not mean that things have changed on the ground. The report might look good, but it might be different from what is happening on the ground. So that's why now we have sponsored in the meeting yesterday to say, let's have a second round of our meeting where we will agree on a process plan of going down to facilities to identify what are the problems, so that when we sit around the table again, we will be able to say, in this facility number one, there was infrastructure issues of shortage of human resource, issues of medicine shortages, this and that and that and that.
Those who are running these public health facilities have always hidden behind committees at clinics, the suggestions and complaint boxes. And looking at the report, it clearly says to me that these are not effective. Would you agree with me?
When you go to clinics, you ask yourself, if people in clinic one are complaining about issues of staff attitude, are complaining about long waiting times, are complaining about a shortage of medicines, this and that, where is the clinic committee? Why is the clinic committee not playing its role in terms of addressing this problem? Clinic committees are there by a mere name.
Thank you so much for the interview, and hopefully something good is going to come out of this. We appreciate your time. Thank you.
After the ad break, we speak to Tebogo Lekgetwane, who is a spokesperson for the Northwest Health Department. Stay with us. Welcome back. This is Vital Signs. Now, reports stating that the Northwest public healthcare system is in a state of crisis for many years have flooded the media. Shortages of staff, overworked staff, medicine stockouts, as well as dilapidated infrastructure are just some of the complaints coming out of that province, which is now under administration. Northwest Health spokesperson Tebogo Lekgetwana joins us to talk about plans, if any, to improve the services in the healthcare sector, as well as address issues of stockouts of essential medicines, especially chronic medication. And of course, we'll also request an update on the third wave, as well as COVID-19 in that province, and whether hospitalizations and other issues such as that did cause some issues, and whether or not they were prepared and are prepared for the fourth wave. So good morning, and let's welcome our spokesperson from the Department of the Northwest Health Department, Tebogo Lekgetwana. Good morning.
Good morning, sir.
How are you?
I'm okay, sir.
Very well. All right, I think let's start off the discussion really by addressing some of the big issues here. And this falls around reports about the failing state of the public healthcare system within the Northwest. These aren't new allegations and new stories. And very recently, about 73 doctors within the Northwest went out to basically write an open letter to state what their issues were. What do you guys as a department see these issues as?
First of all, let me say I listened to your guest there, and I sense the political connotation, which I cannot go into, but to suggest that there is lack of political will and commitment, I can say it's far from the truth. I've worked with the Department of Health under a number of NEC for a long time, and the current NEC, I can vow that he is very committed, and he has a program that is being undertaken going across the province, visiting all these facilities and intervening in challenges as he sees them. And we admit that there are challenges. And it's historical. We should remember that before Section 101B came, what happened in the province. And then we take it from there. We were, before 2018, under core management as a department. And that core management meant that we could not appoint some of the key personnel that we had at the time. And we should say clearly that since Section 101B came, we have been able to appoint close to 4,000 officials in the department, fill vacancies, 4,000 of them in the department. And majority of those include those of health professionals, which we are saying that the lack of or shortage of health professionals is a challenge in the country, but particularly to a province like ours, Northwest, which is underfunded, we must say, in the overall picture of the bigger scheme of things. We are saying that the province has improved. There are challenges, but the province has improved since the 2018 unrest that collapsed a lot of services in the province. And the improvement, specifically now, if we talk about infrastructure, we should look at it in terms of the national norms.
Okay.
Yes, there are challenges, but there are national norms that direct how we are graded as a province in terms of facility. And one that program is the ideal clinic realization. Before 2018, many of our facilities were 30% in terms of ideal realization target. Now we are looking at a lot of our facilities around 70% ideal status. And the report is there. I heard your guest saying that the report might not talk to what is on the ground. We need to be clear. There are areas that are challenges, but when you look at the overall picture, there is a lot of improvement. And we do admit that in terms of the medical supplies, there has been challenges in that area. And there is a specific period of about 3 weeks where as a province we were having a problem in terms of network and we could not pay a lot of service providers. That affected us to extend that certain service providers put our accounts on hold. But it's also historical in the fact that a lot of these service providers were not paid in the past due to the challenges that we have been having.
Okay.
But a team has been appointed that has, over the past 2 years, has been looking at these invoices and ensuring that they are paid. And somewhere we also encountered duplicate payments. And that is why there has to be a lot of scrutiny. Some companies decide to put the department account on hold because they have powers to do so. And they have many other avenues where to supply, and they pick and choose where to supply in the country. These are the issues that should not be only limited to the province.
For sure.
But the entire country should look into this monopoly of companies that want to hold us at the consumer in terms of how they...
Mr. Lekhatwane, let me jump in here because you've spoken to a point where you said even on the ground. I mean, I think these things and having, these ideals for clinics and, speaking about these issues is very nice when you're coming from a departmental point where you're in your offices and occasionally will step out on the ground when there's an issue. But we have someone on the line right now, Itu, who actually is someone on the ground and has issues that they've had. Let's listen to their story. Hello, Itu.
Hello, sir.
How are you, sir?
I'm okay, sir.
Good. So give us your experience with the Northwest Health facilities that you visited.
Yes, thank you, sir. Thank you for having me. Yeah, the problem I'm having, last week Friday, I went to the clinic as I was not feeling well to go and test for COVID-19. So they told me that the nurses that are conducting those kind of tests, they are not around.
Okay.
But me, the rest must quarantine. But even today, I'm still waiting for the nurse.
So are you at the clinic today, or you were told that they're not available even on this day?
They said they are not available during Friday. So they promised to send them to my home to come and test me. So now they said I'm at quarantine now. I think it's about last week Friday to today. I'm here. I don't know where to go. I don't know if I'm positive or negative. I'm waiting.
All right. I think I get you, Itumeleng. Thank you for that viewpoint of what you've experienced. So let's get back to the department spokesperson. I mean, issues like this are a dime a dozen. A lot of patients saying that they'd get to a primary healthcare facility or wherever it might be where they've been told that they must go out and go test at these facilities. But when they get there, you get the same old story where, we close at 12. Why are you here at 4 o'clock? And things such as that. What's the department doing to address these issues where everyday people can access their healthcare without being told to come back another day because Mr. A, B, and C are not available?
No, that is why I was saying the guest was talking about on the ground and the report. And I admit that on the ground, there are pockets of challenges. However, when we look at the overall picture, the department is improving. Remember, I'm saying I'm moving from a point of saying that where we come from, there has been challenges.
Mr. Lekhatwane,
we are addressing challenges at the...
Mr. Lekhatwane, I hear you guys say, I hear you saying that you're improving, but what are you actually doing to improve the lives of the people of the Northwest Province? Because what we're seeing, and I know I also work in Gauteng, is that we get so overburdened by patients that come outside of the province from the Northwest and other facilities to come get their medical assistance in another province. So this is an old woman who leaves Mahikeng on a bus at 2 a.m. to get to Johannesburg, to get seen, and only get back at 9 p.m. How are we addressing these issues? What's the practical stuff on the ground that you as a department are actually doing to solve these people's problems?
Well, from what you are saying now, you are bringing us to cross-border issues because there is no woman who can leave from Mahikeng to Gauteng to go and get pills unless it is a transfer on a tertiary health service issue that is clinical. But that also, you can look at the stats. We have reduced the number of referrals to Gauteng because we have now tertiary hospitals in our province, more than one. Remember, we used to have only Plexdep Topo as our main tertiary hospitals. But now we have also Rustenburg, Jobsimankane Tabane Hospital. We also have now capacitated hospitals like Mafikeng, your Potchefstroom, where now major services that require highly skilled personnel were used to refer to Gauteng. And that is beginning to change because we have employed personnel. We have, ever since now, had the first hard operation in the province because we have that skill now in the province, of which we used to do in Gauteng. We are the first province to treat MDR-TB. As we are speaking, because you're asking me what are we doing, our MDR-TB in Klerksdorp Tshepong Hospital is closed because we treated all those patients who had MDRs. The daily challenges that patients are experiencing, most of them would refer, especially to the patient, the person who just spoke, to a situation where we still have clinics that some of them operate 12 hours. And we would say that if a clinic operates 12 hours, then there should be a nearby community health center which operates 24 hours, so that community can go into that facility. And there are still challenges that we admit that there would have been a transport that would be available for the patients to be taken to a 24-hour facility when the 12-hour facility closes. And sometimes there would be a challenge in terms of transport. And those are the issues that we are attending to.
Okay. Just to wrap things up, I think an important thing, especially for people that are listening or watching from the Northwest, what should they do if they can't access medications, if they can't access personnel on the ground to solve their health problems?
The MEC, who is now on the ground as I'm talking, has appointed coordinators in districts, stakeholder relations managers in each and every district, to ensure that they liaise with community. Our communities have governance structures, and these are the people they appointed in all these facilities who link up with the department when there are these kind of challenges, so that they needed reaction to the challenge and it is addressed. It is important that they bring up the matter to the department, and then we definitely attend to problems as and when they arise. But there is a long-term plan to deal with a lot of these challenges, including infrastructure, maintenance, as well as personnel. The infrastructure in particular, in terms of access, we have now also where there are clinics that are dilapidated, that cannot be renovated because of the structure that is old. We have procured temporary structures for those clinics to operate, while we are still planning to build long-term structures for our communities.
Okay.
It's a program of redirecting the system, the entire system, the health system.
Yeah.
We need to admit that it needs to change and be redirected to a developmental state of affairs.
All right. Thank you so much, Mr. Tebogo Lekgetwane, the Northwest Health spokesperson, for giving us your insights on what the province's department is actually doing to solve the issues of the Northwest. And that was that. After the break, we discuss and, of course, and continue our discussion with Prof. Binu Luke, the clinical lead for COVID response and vaccination in that province. Stay with us. Welcome back. This is Vital Signs. I'm Dr. Musam Tombene, and COVID numbers continue to decrease in most of the provinces, but we continue to see some hospitalizations. While government continues to educate South Africans about the benefits of taking the vaccine, many people aren't vaccinating. Misinformation and fake news about the vaccine, of course, on social media have been blamed for the low numbers of people that are actually vaccinating. Let's chat right now to Prof. Binu Luke, who is the Northwest Province's clinical lead for COVID response and vaccination, to give us an update on what's happening with regards to COVID and vaccines in that province. Good day, Prof. How are you today?
I'm fine, Dr. Musa.
Good. So let's get into the discussion. We've had 3 waves of COVID, and of course, in the Northwest, you've had your own experience of what COVID has been like for you. Can you briefly tell us about that?
Yes, we have been affected by the three waves, and if you were to compare the first, second, and third wave, like the rest of the country, the third wave was the severest. The first wave was the most hard to manage because we were just getting used to this new disease. We didn't know how to manage it. We had to repurpose beds, so there were a lot of anxiety among healthcare workers, and it was difficult to get everybody on board and get it going. Then came the second wave, which was higher than the first wave, but we were better prepared. And in fact, we did not expect a third wave, but the third wave came. The numbers were much higher. We had about 1,700 patients as its peak for a few days in the third wave, while it was just over 1,000 in the second wave. And but we were much better prepared during the course of the second and third wave, and we were able to manage it. And yesterday, when I looked at the numbers, when we had only about over 100 patients newly diagnosed, and we look at the charts, we can see that the numbers are definitely coming down. During the first wave, we had planned a certain form of centralized and decentralized way of managing COVID in terms of diagnosis, referral, and management.
Okay.
We also have to look at the severity of the illness and then get appropriate facilities to manage them. So we were able to get some dedicated hospitals for COVID care. Klapshop Sapong, you heard in the previous interview, was the main hospital, but also we then created Westwall Hospital. We had Dubscott Hospital, we got Masebe Hospital, which is specific for COVID care. So we have almost 1,200 beds allocated, repurposed for COVID.
Okay.
And we did not run short of beds in terms of admitting those patients.
So with respect to, I guess, the geopolitical sort of elements that exist with COVID as well as the Northwest Province. I mean, largely rural, and with respect to having all those beds available, but people having issues such as access to those beds. Did you have any issues with this where we're finding a largely rural population, maybe demising or getting more infections, but not being able to do anything about it?
Yeah, no, obviously we have got a rural and peri-urban split, and you know that the congestion or the population density is high in the more peri-urban areas of Klerksdorp and in Rustenburg. So even if COVID was there across the province, the load of COVID cases in the rural areas like the RSM district were much less than the load that we faced, for example, in Klerksdorp, Potchefstroom, in Rustenburg and Mafeking. And all of those areas had, adequate number of beds. There were days where there were challenges, especially in terms of the severity. If you have the more moderate and severe cases, then we have to actively repurpose beds which has oxygen reticulation to make sure that they are treated. But in terms of providing a bed to a patient, we were able to then. We have a bed management system. Through that, we were able to move patients around in such cases. And lastly, in Freiburg, which had the lowest load, we opened a 35-bed high care facility, a prefab building that opened during the third wave. So I think we had to move patients sometimes, but in the rural areas we have got district hospitals, and district hospitals have got fewer number of beds, and it is also difficult to repurpose a significant number of beds in these smaller hospitals. So unfortunately, patients who need admissions will have to be moved to the larger hospital because the COVID bed and the dedicated beds have very specific requirements in terms of isolation, quarantine, and infection control. So it's not that we are able to create a bed in an open ward. So we need to have repurposed bed. So when you have lower number of beds in a hospital, we unfortunately will have to transfer the patients where those facilities can be ensured.
Let's talk about vaccines and the Northwest. I mean, a lot of people around the country, we're hitting quite high benchmarks with regards to the number of people that are vaccinating per day. But are you seeing the same turnout in the province with regards to people that are coming out to get their vaccines?
Look, our overall coverage as a nation in terms of vaccine coverage now is sitting at around 25%, and we are, as a province, sitting at 21%.
Okay. So
we have not exceeded the average, the national average, but the trend, if you look at the uptake for vaccine, is the same across all provinces. There has been an uptake at a certain point, and then it peters down. Yesterday, myself and the MEC was with the religious leaders the whole day talking to them about the science of COVID, the science of vaccine, because, this issue of the conflict between faith and science, we need to deal with it decisively. In fact, there is no conflict between faith and science. And if we can align these two aspects, then we can get a lot more, a lot more people, coming up for the need for vaccination. One of the things that I've been thinking is that, yes, COVID has actually put pressure on the economy, restriction. It has affected families, but only about 5% of the population has been affected, clinically diagnosed as COVID. And we have got a fairly good recovery rate of 95%, and our mortality rate is around 2.5 to 3%. So I have a feeling that many of the individuals, they get on with their lives, restricted or unrestricted, without really worrying about COVID. And also, and especially, the message has been the vaccines prevent hospitalization and death, which is true. But what the youngster and healthy need to understand is that if they get infected, they can transmit it to the elderly and the vulnerable, and they may lose their loved ones. So even though there is an element of personal protection of the vaccine, there is also a societal protection that you as young and healthy need to come forward, because that is the bulk of our population. In fact, 35% of our population is below the age of 18 years, which do not qualify for vaccination. So we are actually targeting 65% of the population. That means almost everybody above the age of 18 years have to get vaccinated if you are to talk about population immunity through vaccination. And even within that, the 18 to 50 is the bulk of our population, and these are the population who are not exactly as vulnerable as the one with comorbid disease and the elderly.
Prof, let me jump in there just for a second. Let me jump in there. We've got Thandiso who would like to ask a question or really just state a fact about vaccines with a good day. Thandiso.
Good morning, sir. How are you?
Good, sir. Good, sir. So let's talk about it. What's your question? Yes.
Yes, and Dr. Luke there. Look, my brother, the issue of vaccine in Dr. KK, I don't know why it's so slow. Because when you can go to townships, people are not vaccinating because we don't know. They get they teach them how they give them good information as Department of Health. Because I think there is these issues with the MEC of Health in Northwest, Matora Sambat, to say, please educate people of Northwest. Take out the resources so that they must learn how to go and vaccine. How vaccine is so important. So that if we can go here in Northwest, people, it's like things are normal.
They're acting like things are normal. Yeah, I hear you, Thandisa, and I think I got the bulk of your question there. And it goes back to you, Prof. Luke, about what should be done to get people to know about vaccinations. I mean, I think it's not enough for people to say, go Google or, figure out where you must get the vaccine. What active means needs to be taken for the people of the Northwest to find out where they can get their vaccines?
I think one of the things is to say that, that's what the point I was getting at, that these young and middle-aged people who are otherwise healthy and active, they need to understand that vaccination also prevents transmission of the virus. If the virus transmits, then you will have these waves. Some of our loved ones will get to hospital, some of them will die. So this is about a action that we need to do, unprecedented. We never had to do something like this ever in our history. So we have to do something that we do as a social responsibility to protect the society. I don't know how we can get that message through. This is not just about you. It's about us. So we need to vaccinate so that we don't get the illness, even if it is mild. We shouldn't be getting it because then we will be transmitting it. So vaccine prevents us our risk of getting the illness in the first place, even though it may not 100% prevent you from getting infection. So obviously, when we look at the registration versus vaccination, we have vaccinated almost 80% of the people who have registered. And when I looked at the 50 to 59 group in the province, almost 100% of them who have registered have vaccinated. So anybody who decides to register seem to get vaccinated. So this is indecisive people that whether they should register or not. I do not know whether the registration process is a deterrent. So we need to make sure that access to the registration process, EBDS, is explained,
Yes, Prof.
so that they can register. So we need to have activities where the registration process can
I'm going to
happen.
jump right in there, Prof. Sorry to disturb. We're out of time, but I think the gist has been met. It's basically about you. You're not just doing this for yourself, you're doing this for society, in the words of Prof. Binu Luke, saying that maybe we need to come up with strategies to improve people registering or decrease the barriers that exist that allow people to go get their vaccines. Of course, that was Prof. Binu Luke, the clinical lead for COVID response and vaccinations in the Northwest. After the break, Zamabu Tulezi takes us through the latest COVID-19 numbers.
Good morning to you, Musa, and Vital Science viewers. I'm Zamabu Telezi. According to reports, South African scientists have identified a new coronavirus variant. There is a concerning number of mutation. Even though this C12 variant has been detected across the majority of the provinces in South Africa, experts say that there is no need for panic, saying while it might be able to partially evade the immune response, vaccines will still offer high levels of protection against hospitalizations and deaths. This part has to be combined with all the other public health and social measures. Also remember that the new Delta variant, or the old Delta variant that is more transmissible, is still around. For now, though, let's take a look at the national COVID-19 statistics. In South Africa's public and private sector, over 6.8 million tests have been processed. To date, over 2.8 million people have tested positive for COVID-19. 2.6 million of those people have recovered, but regrettably, more than 84,000 people have died from COVID-related illnesses, and we're sending our sincere condolences to their families. More than 14 million people have been vaccinated against COVID-19 in the country. So what's happening in the provinces? According to reports, there is a decrease in the 7-day moving average daily number of new cases across the provinces of the country, but numbers of new daily infections is not stable. Gauteng remains the epicenter of the third wave of the pandemic, with a huge drop in the daily new infections compared to KwaZulu-Natal, the Western Cape and the Eastern Cape provinces, where majority of new cases lately come from. And also there has been an increase in hospital admissions. For now, though, let's take a look at the infection numbers recorded in the provinces with big metros. Since the first case was recorded in early 2020, over 910,000 positive cases have been recorded in Gauteng. This province is seeing a decrease in new infections. Close to 500,000 positive cases have been recorded in the Western Cape. This province is seeing an increase in new infections and hospitalizations. Close to 500,000 positive cases have been recorded in KwaZulu-Natal. This province is leading with new infections. Close to 300,000 positive cases have been recorded in the Eastern Cape. This province is also seeing an increase in new infections. It is expected that the new variants will continue to emerge wherever the virus is spreading. We are all reminded that vaccination remains critical to protect those in our communities at high risk of hospitalization and also deaths, and also reduce the strain on the health systems while helping to slow transmission. For now, though, let's take a look at the numbers recorded in the remaining provinces. Since the first case was recorded early last year, over 150,000 positive cases have been recorded in Free State. Over 147,000 positive cases have been recorded in Mpumalanga. Over 146,000 positive cases have been recorded in the Northwest. Over 120,000 positive cases have been recorded in Limpopo. Over 85,000 positive cases have been recorded in the Northern Cape. So vaccine registration and inoculation is still open for those ages 18 and over. You are all urged to register and go out there in numbers to vaccinate to lower COVID severity and hospitalizations. Let us continue to take precautionary measures, and these include regularly washing our hands with soap and water, sanitize using sanitizers containing 70% alcohol content. Remember to wear a cloth mask that covers both your nose and mouth. Practice social distancing and ensure proper ventilation indoors. Lastly, avoid mass gatherings. If you believe there is a chance you may be infected with the virus, call ahead to seek medical help from your healthcare provider or use the public hotline. It's a free number, 0800 029 999, and alert them to your symptoms. Remember, protect yourself to protect others. Thank you, and back to you, Musa.
Thank you so much, Zaba Buthelezi, for that update. Let's chat to Dr. Marlon McKay as we answer some more of those COVID-related and vaccine questions. Dr. Marlon McKay, how are you today?
Very good. Thanks, Musa. Thanks for having me again.
Good. Let's jump right into it. People that have gotten the flu, I feel like it's something that we probably have to look at every week because, you know, you get new viewers all the time. If you've been sick with the flu or any other cold-like illness but tested negative for COVID, when can you go get the vaccine?
My suggestion is that as soon as you have recovered, we don't want you to rock up at the vaccine site still symptomatic. So the moment your symptoms have settled, especially if you've had a temperature, if you've had a fever, once that is settled, there's no waiting. You can go straight to have the vaccine. So it's unlike with COVID where you have to wait a certain amount of time, 30 days. The moment you are better from your cold or flu, no more sniffles, no more temperature, go for the vaccine.
All right, an important thing to note are comorbidities. You know, it's a word that we've heard over the past 2 years where people now understand that it's when I have something that I take medication for or I'm sick from. What do we do with patients that require vaccination but also have comorbidities? How do we pair the two together?
Yeah, so I think the take-home message, if you have comorbidities, it means that you are generally in a more precarious position compared to someone who does not. So healthy people generally do not have comorbidity. Someone who has a comorbidity means they have a condition that requires them to take chronic medication. Now, the moment you have a comorbidity, you've been labeled as someone who has a comorbidity, you are at higher risk of getting more severe COVID compared to someone who doesn't, and at higher risk of hospitalization or even dying from COVID. And so therefore the principle is, if you have a comorbidity, if you are on any chronic medication that you have to take every day, it means that you need the vaccine more urgently than someone who does not have. You need to be there first in the queue to get that vaccine, because if you do get COVID without being vaccinated, you're at higher risk of more severe illness, hospitalization, and even, unfortunately, dying from COVID.
So let's talk about the management of symptoms when someone is COVID positive, but they're not severe enough to require hospitalization. There's a question here from Lauren Carthy saying that at what point did you decide to go into hospital? I'm on day 7/8, and on my 4th day of a fever, coughing and phlegm quite a lot, sleeping all the time. Not sure if I have difficulty breathing or if I'm just trying to catch my breath after violently coughing. When it comes, or rather when it calms down, I seem to be fine, and I'm doing breathing exercising and lying in the right position, steaming, nebulizing, and. So I think the question here, or what needs to come out, is at what point do you decide this is enough? I need to actually go to a hospital because this is not normal anymore. When is it becoming a little bit limiting?
Yeah, so that's such a very good question. So I think, you know, most of the time, if you talk to patients, they will know, because you can feel that there's something here that I cannot control. And generally, we're looking at shortness of breath, severe tight chest, bad coughing, but it's trouble in breathing to the point that you may even become delirious, confused, disorientated. You're not speaking properly. You're not able to make sense. And sometimes you may even start turning blue. So you have that longing and gasping for extra air. You just cannot get in enough oxygen or enough air. Obviously, the objective measurement would be the oximeter, which measures the oxygen concentration. And you see that dropping to below 80% into the 70s. Then you know that you are in trouble. But symptomatically, any deterioration, especially in your mental status, and your ability to breathe like you're suffocating, is a message that you need to urgently get to hospital.
All right, another question from Harleen, and I think it basically covers, the period between getting COVID. Let me read it. I had COVID on the 12th of June. I came into contact with a positive case yesterday. Should I isolate? Do I still have antibodies? And if I had COVID more than once, what is the period between it? Less than 3 months? That's the question there. But I think the question I want to phrase into this is, there are so many different strains of COVID, and obviously people can keep getting reinfected with COVID. What is the role of antibodies then in this case?
Yeah, good question. So the role of antibodies, now at this point in time, we've had the beta strain recently, and currently we have the Delta strain. Mm-hmm. So if you've had an infection in June, with whatever strain, say for instance the beta strain, you then have natural immunity antibodies that will protect you for at least a few months, maybe up to 6 months, for that particular variant. So in the event, such as in this case, where you have come into contact with someone who is positive now, yes, you must go into quarantine because you don't know what strain that person has. Mm-hmm. And if it's a new strain, so for instance, Delta or one of these new variants, you are right back to square one and at risk of getting COVID again. Your antibodies generally would only protect you against that particular strain that you had, which no one really knows. Mm. And this is why, if I can just make the point quickly, why the vaccine is so critical, because the vaccine gives you generalized immunity against most of the strains, whereas natural immunity is short-lasting and only against the particular strain that you have had. So you have to go into quarantine, monitor for symptoms, do not leave the building for at least the next 10 days.
I think let's individually tackle that, and you've just said it now, where the anti-vaxxer will very joyfully in their heart say, yeah, but that's just the Delta and you've just got the vaccine for that. What about the many other strains that are to come? How does that get changed in this sense?
Yeah, so again, the vaccine, the data is so positive. The data is absolutely rock solid, very robust data to indicate that a vaccine, and remember these vaccines were developed even before Delta, and yet look at the tremendous protection that we see against the Delta variant. Mm. So the vaccine, by definition, protects you against SARS-CoV-2. There may be minor variations in the protection against the individual variants, but overall, the protection is there. So we don't have to even stress about what's still coming, what variant is going to have in December, or the fourth wave. As long as you're vaccinated, you can have that assurance. Yes, you may get COVID, small chance, but the risk of landing up in hospital and dying from COVID is virtually zero once you have that vaccine.
And that's how we wrap it up. Thank you so much, Dr. Marlon McKay, for answering those questions and, of course, dealing with all the fake news and mysteries that exist via WhatsApp groups and friends chats and, discussions around the water cooler. Well, that is the end of that, and that is the end of our show. Thank you so much for joining us as we covered and took a look at what the Northwest Health System is currently going through, especially looking at COVID. And hopefully everyone within the department will make bigger strides to make the lives of the people that live within that province a whole lot better. From the Vital Signs team, we'd love to love and leave you. We'll see you again soon.